It's common for people to get confused about the differences between Medicare and Medicaid. Here at Boomer Benefits, we specialize in Medicare, which is the federal health insurance program for people age 65 and older and individuals with certain health conditions. However, it's entirely possible to be eligible for Medicare and Medicaid if you meet your state's eligibility criteria. The Centers for Medicare and Medicaid Services, CMS, has an office that is tasked with coordinating benefits between Medicare and Medicaid, and this makes it easier for people who qualify for both programs to get healthcare coverage. Hi, I'm Danielle Roberts, Medicare expert and co-founder here at Boomer Benefits, and in this video, I'll discuss options for people with Medicare and Medicaid and explain how individuals can qualify for the various Medicare Savings Programs that are administered by Medicaid. Medicaid is a social welfare program to provide free or low-cost healthcare services to low-income individuals, families, and children. It also provides benefits for older adults, people with disabilities, pregnant women, and caretakers of children. There are usually no monthly premiums for Medicaid, but beneficiaries may incur low out-of-pocket costs like copays in some states. Medicaid is a voluntary program administered at the state level, although it is jointly funded with both state and federal tax dollars. If a state does participate, it must meet certain guidelines in order to obtain funding from the federal government. Currently, all states do participate in Medicaid. Each state sets its own income and eligibility requirements within the federal parameters. Now, most states base their eligibility requirements on income, disability, pregnancy age, household size, and household role. Although Medicaid covers many of the same services that Medicare typically covers, such as hospital care and doctor visits, it also offers certain benefits that Medicare doesn't. Examples would be long-term custodial care and nursing home care. Some states may also choose to include vision and dental care in their Medicaid program. So if you are eligible for Medicare and your income is low enough, you can qualify for Medicare Savings Programs that are administered by your state's Medicaid program. There are 4 different Medicare Savings Programs, and each one has a different income and eligibility limit. The first is called the Qualified Medicare Beneficiary, or QMB. If you have income that is less than 100% of the federal poverty level and your resources are under the limits that have been set for that year, you can qualify for QMB. When you have both Medicare and QMB, you are considered dual eligible. In this scenario, your QMB Medicaid will cover your Medicare premiums for Part B, and if you are a person who pays for Part A because you didn't have the work history to get it at no cost, QMB can pay your Part A premiums as well. Medicaid can also cover the Medicare copayments and deductibles for you and cover some services not covered by Medicare that may be available in your state's Medicaid program, such as vision, hearing, and dental care. In this scenario, Medicare is acting as your primary coverage and Medicaid QMB is acting as your secondary coverage, so you don't really need any Medigap plan. And this means you aren't likely to need any help from us here at Boomer Benefits because your state benefits are already going to pay for your Medicare premiums, copays, and deductibles. So that's the QMB program, which is the highest level of benefit that you can qualify for with the Medicare Savings Program. Now, if you don't qualify for full Medicaid QMB, you may still be able to get assistance with part of your Medicare costs. Based on your state's limits on income and asset levels, you can qualify for one of the other Medicare Savings Programs, and these help to pay for some of the out-of-pocket costs associated with Medicare. The next level of coverage is called the Specified Low-Income Medicare Beneficiary, or SLMB for short. If your income is between 100 and 120% of the federal poverty level and your resources are under the limit set that year, then SLMB will pay for your Medicare Part B premium. The third level of Medicare Savings Program is called the Qualifying Individual, or QI. This program is limited and is available on a first-come, first-served basis. If you have income between 120 and 135% of the federal poverty level and resources below the limit set for that year, Medicaid may pay for your Medicare Part B premium. The fourth and final level is called the Qualified Disabled and Working Individuals, or QDWI. Adults who are under 65 and disabled, but who recently returned to work and are no longer eligible for premium-free Part A, may qualify for QDWI. To qualify, you must have income at or below 200% of the federal poverty level and resources under the limits for the current year. It may help to pay for Part A premiums if you are a working disabled person who lost your premium-free Part A when you went back to work. I should also mention that people at all levels of the program will automatically qualify for Medicare Extra Help with Part D, which is also called the Low Income Subsidy. This program helps to pay for some or all of your Medicare Part D drug premiums while also reducing your deductible and your share of copays for medications. You can apply for the Medicare Savings Programs that are administered by Medicaid at any time of year. Get an application by calling your state's Medicaid hotline or by contacting your local Department of Health and Human Services office. Some states may choose to increase the guidelines that I've mentioned here in this video, or even eliminate the resource test altogether, so you'll want to find out the eligibility rules that are specific to your state. Before you apply, you will need to gather information such as proof of age and proof of residence or citizenship. You must also provide information about any other insurance you may have, such as Medicare. Your Medicaid application will also ask for some specific financial information. Resources that can help you to determine your eligibility are checking accounts, savings accounts, stocks, and bonds. They will also count mutual funds and any individual retirement accounts that you may own. There are also certain resources which do not count toward eligibility, such as your home, your car, a burial plot, and any personal possessions like furniture, household items, and personal items. Lastly, if your income and assets are not low enough to qualify for one of the 4 levels of Medicare Savings Programs, they might still be low enough to qualify for just the Medicare Extra Help program for Part D. You can contact Social Security to apply for this program online or by mail. If your income is not low enough to qualify for any Medicare Savings Programs, but you find yourself having trouble with affording Medicare, check out the video on other ways that you can reduce your Medicare premiums.